If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Welcome to Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. This is our 8th season, and we are airing once a week. And to begin this spring season, I'd like to answer the email questions many of you have submitted on our website at netny.net. We will try to get to as many of them as possible, and I encourage you to continue sending in your questions at netny.net. Now, this is a special episode. 1, because we are covering more topics than usual, and 2, because we're in the midst of a health scare, the swine flu. I had the opportunity to talk with Brother Leonard Conway, the principal of St. Francis Prep High School in Fresh Meadow, Queens, who was in the middle of it all. Let's listen into the conversation. With me on the phone tonight, I have Brother Leonard Conway of St. Francis Preparatory High School in Queens, which has really been the epicenter of the entire swine flu outbreak in the United States. Good evening, Brother Leonard.
Good evening.
Thanks for joining us today.
My pleasure.
When did life, as you know, as usual, take a turn, a different turn? A couple of weeks ago? Yeah.
Life here at St. Francis Prep took a dramatic turn last Thursday, beginning at around 11 o'clock in the morning, when a vast number of students started reporting to the nurse's office with flu-like symptoms, headaches, slight fevers, nausea, stomach aches. And that continued throughout the rest of the day. And I have to say that our nurse, Mary Pappas, should highly be commended, because after the first wave of students coming into her office, she immediately got on the phone with the Department of Health and alerted them to something is going on here at St. Francis Prep, and they said they would get back to her. By the end of the day, we had approximately 75 students that went home with what we would call early dismissal passes. In other words, they left school early, their parents came and picked them up, and we recommended to their parents that they, if this continues, that they should see a doctor. The day ended, Friday came around, and it still continued to happen, which was really rather alarming, except on Friday. It was starting virtually right after we had the opening school prayer on the PA system. Kids were going to the nurse's office. The Department of Health did call us and said that they were getting there. They arrived at about 1:30 and took some initial interviews and said that they were sending their investigators to take some samples of the students. Unfortunately, they got stuck in traffic and did not get to the prep until 3:30. So the end result there was that there were still about 8 students here waiting to be picked up by their parents. So those students had called their parents and asked permission to be tested by the Department of Health. So those were the first students that were tested, and they were the only students that were tested here at the prep. And that brought the total of kids that went home with this early dismissal concept of about 150 students. The next result was on Saturday. We got word that those students had tested for a type A influenza, which meant that it needed further tests. Then on Sunday, we got the news that 6 of those students tested had a mild case of swine flu. And it was at that point that I decided that we had to close school Monday and Tuesday to keep the kids home and not spread it any further. And as you know, as time went on, the number was increasing. But the Department of Health is not really pointing the link necessarily, saying that it's definite that these kids got it in Mexico and brought it back. Their major concern is they have it, so let's deal with it. But I'd like to emphasize the fact, because a lot of the media out there are saying it was a class trip or a school-sponsored trip. No way was it, and I send out a letter very strongly, a 2-page letter that says it is not a good idea for kids to go away unsupervised. And trips like this are groups of kids from schools or the neighborhood, and they're just off on their own with no adults. And the letter has been going out for years, but I do know some of our kids were quoted in the paper saying that they were there.
I'm glad you cleared that up, because I think it's important that parents always be careful where their children are going.
Exactly.
You know, and, what about the psychological aspects? How did you deal with that to calm people down? What were some of the things you found useful?
Well, I would say keeping them up to date on our website and on our phone system. Anytime I had any type of information, we immediately put it on the homepage of our website. We put appropriate links there that they could get the latest information from the Board of Health and what to do if you have symptoms. We were really trying to, prevent the panic, because it seemed like there were a whole bunch of kids, if they were just not feeling right, parents were taking them to the emergency room. And most of the recommendations were, if you had a high fever, you should definitely see your pediatrician if you have a high fever and flu-like symptoms.
Was it recommended that the school be wiped down, sanitized?
No, we did this. It was not requested that we do that. We did that as a precaution. So we began Friday night, I think about 7 o'clock, since the international night had been canceled. We had the crew was in waiting for the kids to leave if we had it. So the supplies and the crew were here. And we began Friday night, and we completed Sunday night at about 10 p.m. And they cleaned and they washed with a heavy-duty disinfectant every single chair, table, desk, wall, counters, offices throughout the entire building. And as I said, they finished Sunday night. But we did that to be proactive as a precaution because, to our knowledge from the Department of Health, it was only transmitted person to person.
No, I'm telling you, the example that you've set in handling this is just amazing. I hardly wait till you can get, this blows over a little bit, and we can get you down here and get you on the TV so that the people can see just how good you look on this.
I look a little tired right now.
But I can't thank you enough for coming on. I think it's going to be very important for the listeners to hear this and for other students. And I think this experience that the students from St. Francis Prep are going to grow immeasurably with this, have opportunities for discussion later on, for stories, even on college interviews, I can imagine.
Yeah.
So thank you so much for taking the time, and the best of luck, and thank everybody at the school for us.
And thank you for airing this, and thank you for all of your support. And the diocese has been great about supporting St. Francis Prep and calling in to check on how we're doing. So I just want you to know that with the greatest news that I'm hearing today on the radio is that the 45 kids are recovering quickly, and that all good things are going on, and we should be ready to start again on Monday.
Thank you. Thank you, Brother Leonard.
Good night now. Take care.
Be well.
Right.
Thank you. That was Brother Leonard, who, just an amazing individual, a very modest person who was able to pick up on a disaster and make it into something that was manageable, allayed the fears, and really set an example for the world on how to deal with such a situation. Thank you once again, Brother Leonard. As you can see, Brother Leonard's efforts in satisfying parents and students and teachers' concerns are remarkable. He will discuss swine flu further, but let me first introduce our panel of doctors. I have with me Dr. Margarita Khotsyna of Geriatric Medicine at the New York Methodist Hospital. Next to her, I have Dr. Montgomery Douglas, family physician, Chairman of Family and Community Medicine, New York Medical College. Then I have Dr. James Rucinski, surgery attending at New York Methodist Hospital. Welcome. Usually at this point, I talk about 3 health topics that are in the news, but I have special telephone interviews that I want to get to. On the line, I have Mary Pappas, the nurse from St. Francis Prep High School. Mary?
Yes.
Hi, how are you?
Okay, how are you?
Thanks so much
for
being.
me.
Thank
Sure.
you. Yeah, thanks so much for being with us tonight.
Okay, sure.
How long have you been at St. Francis?
I've been there 6 years.
6 years. You ever have anything as exciting as this time?
We did have a bout of whooping cough.
Whoa.
about the first year I was there, but it didn't amount to last Thursday.
Well, Mary, so tell me, when did you first realize something was wrong? Let's just, so we can play the scene out for the audience.
Oh, sure. Thursday started like any other day. You know, usually I have a busy office because we're a big school. But about 9:30 in the morning, 4 or 5 seniors came in with fevers, which is, you know, kind of unusual. It, you know, it was of interest to me. I tried to figure out if they were in the same homeroom. You know, a couple of thoughts went in my head. I didn't have much time to think, though, and then the line started to get bigger, and more kids were on my line, looking very distressed and not feeling well.
Was there an anxiety level there?
Not yet, not at the moment, not at that moment. They just look like, you know, death warmed over. And I had 2 very good assistants, and we started taking their temperatures. And by 10 o'clock, I realized that we had an issue here. So I went and I told my sisters, I'm going to go alert the principal, which I did. And I came back as quickly as I could because we were starting to get overloaded. My line at that point was out the door.
Wow.
And we were showing signs of fever in all the classes, freshmen to seniors. So,
well, what did you think was going on?
I realized that there was some kind of, you know, contagious flu or virus going on, and this was bigger than what we could handle. So it wasn't much longer, maybe 20 minutes to a half hour longer, when I told my assistants, look, just carry on, keep doing it. I got to go alert the Department of Health. So Brother Leonard let me use his office. I was able to call Dr. Krigsman, the supervising nurse of the Department of Health. I keep in touch with him quite often for other medical questions and, you know, issues that may arise, and he's always been readily available. So I had his cell phone, which was very helpful.
Was there any nausea or vomiting of the students at this time?
There was actually one student who vomited, and she vomited right in my hallway, which was not that nice.
No.
So I had to reroute my traffic into my bathroom. So this made it a little bit more unconventional, and kids started to look, you know, they just looked a little despaired, not feeling good, looking at me with, like, when are you going to get to me? But I felt better that I called the Department of Health, got to Dr. Krigsman. He told me to call Ada Santiago, who let the CDC know. And then they gave me special instructions, which I handed over to one of the assistant principals to get ready for me, because I needed to go back and attend to the kids with my assistant.
Just to put things into perspective, I think you were brilliant in the way you handled this. At this time, nobody was really talking about swine flu. Actually, President Obama visited Mexico the week before, and he had no idea that there was any swine flu there. So for you to jump ahead and to say this is more than just some kind of a normal, everyday cold that kids are getting, or something that might be in the air, that you really responded quickly. It's remarkable.
Oh, thank you. Well, I was just really doing my job based on my experience that I've had for all these years as a nurse and working with kids. And I knew that this was something a little different and needed to really be looked on. You know, I've been in the public and community nursing, and, you know, your instincts and your organization just, you know, come out.
Can you give us an update now? Where do we stand? How many are still sick? What's going on?
I believe there's 45 that were tested and positive, but they're all on the mend and resting and getting better. I don't believe anybody's in the hospital, and you know, we're just working on getting them, you know, better, but they're all resting at home.
So Mary, thanks so much. I wish we could clone you and put you all over the city and the schools, because you did a remarkable job, and I think the parents at that school should feel very grateful and lucky to have you there. So thank you, and I hope you're going to become an Ask the Doctor listener or a viewer. What do you think?
I think so, definitely. I'll check you out.
Well, remember, Tuesday night at 8?
I will.
What won't you be watching?
I'm sorry, I won't be watching American Idol.
Very good. Okay, very good, Mary. Take care.
All right,
and be
thanks
well.
for having me.
Take care. Next, we have 2 different perspectives, Carol and Chris. Carol is Chris's mother, and he is one of the students infected by the swine flu. Let's hear it from Chris first. Hi, Chris. How are you?
I'm good. How are you?
Really, thanks a lot for coming on. I really wanted the other students and people throughout the city to hear about your experience, because a lot of people hear swine flu and they think that is automatically going to kill them in something. We want to try and give it a perspective from someone who's had it. So tell us a little bit about how it came on and what you were feeling and how it compared to other colds you might have had.
Well, at first I had a headache and like a minor cough, and then it started developing into a fever, which had lasted me like maybe four days, and it got a lot worse. And now I still have the cough, and my voice is a bit cracky.
I hear that. Were you able to hold any food down?
Yeah, I only felt nauseous 1 or 2 times, so I was able to eat like slight amounts.
Had you made the trip to Mexico?
No, I did not.
Right, but I guess you had close friends who had?
Not that I'm aware of, no.
Really? Interesting. And when you first got it, what did you tell your mother?
I think I'm getting sick.
That's good. And you didn't think of any swine flu or exotic illnesses. You probably thought it's like the regular flu or a cold that you might be getting.
Yeah, I didn't think it was going to be much.
Well, do you have any brothers or sisters?
Yep, I have 2 brothers. One lives here.
Did they try and isolate you from them, or how did you work that?
I just stayed in my room.
That's good. And I'll tell you, how does it feel like to be you're kind of a celebrity? I mean, this is the epicenter of the swine flu, which has turned into probably the biggest event of this year, both economically and health-wise. And I'm sure that put a lot of spotlight onto you. Have you been getting a lot of calls from friends and family?
Yeah, just to make sure I was feeling okay.
Be very interesting. This is going to be very good for college interviews. You know, you'll have a very nice conversation. Is your mother there?
Yes, I'm here.
Hi, how are you, Carol?
I'm fine, and you?
Great, great. I'm so glad that it's turning into a happy ending for you, that he's doing better and seems like he's going to be fine.
Yes, he's going to be fine. He's definitely progressing, and you know, I can see the illness is coming to the end. He's feeling better. He did have a rough couple of days there with the fever and, you know, not feeling well and coughing, but, you know, it's getting to where he's going to be able to, I believe, return to school when it opens on Monday.
What was your take on how the media, or how the school handled the situation, how the public handled? What would you? What do you think?
I think that the school, St. Francis Prep, handled it very well, and you know, they did the right thing for the students to keep it contained so it didn't spread further through the population, and you know, they are very good with giving updates on their websites to the parents and the students as well. We receive emails, and you know, as far as the media goes, I think the city is doing the right thing.
Have you been contacted by a lot of media people for interviews for your son and so on?
No.
Good. I think it's you know, it's good because he's tired, he's sick as it is. Did anybody suggest that you take any of the medications such as Tamiflu?
Well, actually, Christopher was taking Relenza, which is an antiviral medication, and he took it for 5 days. And actually, I'm taking the Tamiflu because I'm asthmatic, and I was his caregiver through this whole thing. So my doctor didn't want me to become infected.
You know, I'll have you here, and we're going to get into a little bit later on in the show about Tamiflu and who should take it and when. Do any of the doctors have any quick questions for the family or for Chris?
Well, Chris, I wanted to ask, did you have sore throat also?
What was that?
Did you have a sore throat, Dr. Douglas is asking?
Yes.
And what about runny nose?
A little bit, on and off.
Okay. Stuffy nose?
Yeah.
Okay.
See, a lot, you know, I think that the additional symptom to this flu has been the vomiting and diarrhea. Typically, flu involves cough, the lungs, and so on. And this one is acting a little bit different with the vomiting and diarrhea, which helps to distinguish it a little bit. Although it's pretty much like a regular flu. It's hard to tell if it's the regular flu or the swine flu at this point even. Any other questions? No. So, Chris and Carol, I want to thank both of you so much for coming on. And, you know,
very welcome.
The public can hear somebody who's been through it and is still here and is able to talk about it. And thank you for helping to keep things calm and to set such a great example.
Well,
No
thank
problem.
you. Thank you for having us on, Dr. Garner.
Be well. Take care. So, let's go to a short break right now. And when we come back, we'll talk to the doctors briefly, and then we'll go right to your questions. So, don't go anywhere. Welcome back, and as you can see, we're in the middle of the swine flu hysteria, but we're trying to bring order to this and show that it really is no cause for hysteria and that things are progressing in an expected fashion. But first, let's meet our panel for this evening. I know loyal viewers will recognize all of these people. Dr. Khotsyna, thank you so much for being with us. And
Sure.
anything to report to the audience? What do you think about the swine flu?
But I think it's scary, and I have more and more people coming to the office very concerned about being contaminated with the swine flu. And even though people having just a regular cold, something very minor symptoms, would like to get tested. I still believe strongly that there is no reason, there is no need for hysteria. What we'll have to do is just be aware of what's happening, just do something like very simple things, and everyone is aware of it. Just wash your hands and try to stay away of people who is coughing and sneezing, or if you do develop symptoms such as coughing, sneezing, fever, sore throat, see your doctor and stay home. Don't go to work and don't spread the infection.
Thank you. Great advice. Dr. Douglas, I know the swine flu is on your mind, but you have a more personal disaster situation back home, right, in Dominica. Maybe you could tell the audience what happened and what you're trying to accomplish.
Yes, I'm on a campaign to try and rebuild my church. Church was destroyed by an earthquake back in 2004, and so far they've only raised a quarter of the money that it would take to rebuild the church, the Portsmouth Roman Catholic Church in Dominica, West Indies, not the Dominican Republic. So we launched a campaign on Saturday in collaboration with the Knights of Columbus, Father Farrell Council in Hewlett, Long Island. And the first event we raised $7,500, and we are looking for people to pledge monies so that we can continue to build the money, and we can send it back and get that church rebuilt.
How many members of that church?
Church hall is about 700 seats, 700 people.
What's the name of the church?
The St. John's Roman Catholic Church in Portsmouth, Dominica.
And we'll put a number up where you can get some more information if you want to help out. And I know that Dr. Douglas's family is very prominent in Dominica, like the really royalty, although really top-notch people. I know your brother was the Prime Minister.
Thank you, yes.
Right, and excellent, his blessed memory. And we hope that this helps, and any of our audience that want to help, we hope brings the mission to accomplishment.
Yes, yes, and the church means a lot to me because all 16 of our family members, I'm from a family of 16, I'm number 15 out of 16, and we all baptized, First Communion, and confirmed in that church.
Right, and your sister was a nun.
My sister is a nun. All
Yeah.
3 of her vows were done in that church, and 4 of the 16 got married in the church, including myself. So it means a lot to us.
Great.
Thanks for your support.
Thanks for coming here tonight. And Dr. Rucinski, I know you have also a cause that's near and dear to your heart. We have a dinner coming up next week, American Cancer Society.
Yes, the American Cancer Society Benefit Dinner in Brooklyn is coming up this next Thursday, December 7th, at Steiner Studios, and it's a great event. It raises money for all the activities of the American Cancer Society, which extend throughout the community, both affecting people who are affected by cancer and those who are not, but who have friends and family who are affected by cancer.
So thank you again for coming, and we're going to have to go right to our questions. We have such a busy schedule, so there'll be no trivia question today for those waiting, but we'll have one in our next week's show. And I know we have some questions from the street, so why don't we go to those questions and see what's on the mind of the people in our neighborhoods regarding the swine flu.
Hi, Dr. Gardner. Where did swine flu come from?
Hi, Tim. Good to have you on board. And actually, this was a mutation. This is a change in a virus that existed in pigs originally, which is where the name swine flu came from. And it combined now with a bird flu virus, a human virus, and a pig virus. So now you have one virus that has 3 components. And interestingly, it does not hurt the pigs. The pigs cannot give it to one another, but this virus has mutated to where it can infect people, and then people can infect one another. So it started in Mexico probably, could be up to a year ago. Only the cases are coming to light now as the more severe cases are presenting. But it seemed like the Mexican government was unaware that this was a problem even a few weeks ago. So we expect that this has been around for a while. And the good news is if it's been around for a while, that the deaths, well, we hate to see any deaths, probably represent a very small percentage of all those who get swine flu. Thanks for your question. Let's see what we have next on the line.
Hi, doctor. I have a question for you. I want to know if I can, is it safe right now to eat pig, any part of the pig?
Yeah, Dr. Rucinski?
Yeah, yes, it's safe to eat the pig. The illness cannot be transmitted by eating pork or pork products.
Right, so, and actually that's a big push right now to change the name, not only because the swine sounds disgusting, right? Swine flu, it really sounds like something ominous, but also it's not really have anything at this point to do with the pigs, other than it came from a pig originally, but it doesn't even infect pigs now. So perhaps calling it the spring flu might be a better way, and maybe people wouldn't be as upset about it.
Well,
so.
the president refers to it as the H1N1 virus. That might be a good way.
Right, so. Let's see what else we have now. These are good questions here.
Hey, Dr. Gardner, I would like to know if there's different symptoms between the swine flu and the regular flu. Thank you.
Carolyn, you heard Chris talking about that. Dr. Khotsyna?
You know, in general, I would not probably, there is, you know, most of the symptoms are the same. As Dr. Gardner just mentioned recently, there might be one symptom that it's a little bit different, that the where the H1N1 flu has nausea and vomiting, maybe decrease in appetite. But from the other hand, this is such an unspecific symptom, any disease that accompanied by fever and can cause the decrease in appetite and nausea. So I think it's the most characteristic symptoms for that flu is just a very high fever. Again, it's a runny nose, sore throat, cough. So basically symptoms, you know, of any upper respiratory tract infection or flu, probably more severe.
Great question, Carol. I wonder what else. Let's see what's on the mind of our next video caller.
Hi, doctor. My question is, how are they determining that it is swine flu versus any other particular strain of flu?
It's a great question, because what happens, you go into the emergency room with your doctor, and he has a little kit where he puts a little bit of the material from the back of your throat on a card. It's much like a test to see if you're pregnant or not, and it turns up positive or negative. If it turns up positive, that means that you have influenza A. That's a type of flu, but doesn't mean you have the swine flu. Now they send that to the city, who spend another 4 days on it, and then they see, does this match anything that we have in our lab? If it doesn't match anything that's in the city lab, then it goes to Atlanta for another 4 days. And the Atlanta lab is the only one right now in the United States that can make this diagnosis, which is a problem because it takes 8 to 10 days now to make a diagnosis. So many of the cases that we're hearing now are not from now, but are actually from in the past, because it took 8 to 10 days to make this diagnosis. Something that we have to improve upon in our surveillance and flu and how we deal with flu. So anyway, for the most part, as Dr. Khotsyna was saying, flu is flu, and it appears swine flu and regular flu pretty much are the same thing. So it may not be necessary to know for sure if you have swine flu, since you know you're going to get better anyway. And if you're not having a normal course, if you're having a lot of vomiting and nausea or too high, the fever is very high, then you got to get in and see your doctor. But otherwise, you have the flu, you sit home for a few days, 5 days later, 7 days later, you're better, and you develop some immunity actually to it. So that's great. Let's see. Boy, we have people on the street here, so you can see what's on their mind. No restaurant talk tonight.
Hi, Dr. Garner. I was wondering if there's a vaccine for the swine flu?
That's another problem that we have.
I think there is no vaccine. As of now, there is no vaccine.
There's no vaccine, and it'll take 8 months to make a vaccine. So, and we may not want to rush to a vaccine, because back in 1976, there was an episode of swine flu where a military recruit died at Fort Dix, not far from here in New Jersey. And President Ford said, well, we're going to make a vaccine and vaccinate everybody. And they vaccinated 135 million people to start out. And we had several hundred deaths and rare neurologic conditions that resulted. And as a result, we've never rushed into things again. That the swine flu back in '76 was much less severe than the vaccine, which everybody in the government said they had to take. And actually the CDC, the head of this division in Atlanta, was fired based upon this decision. Jim?
Another important consideration has to do with the resources that we have as a society in order to make vaccines. And if we devote a lot of money and industrial production resources to making a vaccine specifically for this strain, we will probably fall short in the vaccines that we'll need for the coming flu season next year.
That's an excellent point. So let's not rush to do a vaccine. Let's keep level heads. Let's watch the way the virus behaves. Right now, it's behaving in a very mild way. And we'll see after a few weeks if we need a vaccine. But for now, let's go slowly. Okay, I don't know. Any more swine flu questions out there?
Hi, doctor.
Hi.
I have a question. I'm wondering with the swine flu outbreak, I'm wondering if there's anything extra that I can do to help protect my family, my children, and my grandparents.
Yeah, again, I mean, it sounds so mundane, but washing the hands as much as possible, not wearing a mask, because the virus can get in through the eyes, it can get around the mask, and it sometimes gives you a false sense of security. But giving each one of the family members a little bottle of Purell, which is a disinfectant soap, seems to be effective in killing the bug. Trying to avoid touching your face. Now, the average person touches their face. You know how many times in an hour? I looked this up because I had nothing much to do anyway.
How many?
18 times in an hour.
Wow.
That's a lot of times you're touching the face. If you touch a surface where somebody's coughed on, you're going to pick up the flu virus. It can live for several hours on a surface. Put it to your eye, put it to your nose, and that's how you get it. That's probably one of the leading ways to get it. So we want to avoid touching the face. Any other tips from the panel? How to avoid the flu?
Well, the thing people should remember is that the flu is not the same as the cold. You know, a lot of the hype actually when people are coughing, runny nose, sore throat, that is most likely the cold. The cold is much more common than the flu. The flu is the cold plus body aches, not feeling well, and moderate fever. That's the difference between the cold and the flu. And so when you have a cold, you should not be worrying about swine flu. If you have flu symptoms, then you worry about swine flu. But again, swine flu symptoms are very similar to the regular flu, and swine flu is really essentially the same type of disease as far as symptomatology. So that's the thing I would like to add to that. And so the regular hand washing, just the same thing you would do to prevent spread of the cold. They spread in the same way, by the way. It's the same thing you would do to protect your family.
Thanks, Monty. Now let's see, we'll go out to our satellite truck on 7th Avenue. Anybody else want to ask a question out there on 7th Avenue?
Hi, doctor.
Hi.
My daughter got the flu about 3 weeks ago, and she still has a runny nose and a little bit of a cough. Well, we're still going outside and doing things, but I want to know, is she contagious, and how do you know when a child is no longer contagious?
You know, it's interesting. For adults, it's about 7 days. 7 days after you get the flu, and when your fever is broken, you have no symptoms. For children and the elderly, they can continue to shed the virus a longer period of time, and we're not sure how long with the swine flu, how long it is. 3 weeks sounds a little bit much. I'm pretty sure that whatever flu she had at that time is gone, and she could have gotten reinfected. Sometimes when the immunity is down, you can pick up another bug. I'm going to ask our panel if they have any thoughts on that.
I think that sounds like a reasonable theory, actually, that young children do get a lot of colds, and sometimes what seems like the same illness, it actually ends, and then another one resumes, and it looks as if it's the same one. So she looked pretty happy to me in that picture. Yeah. So I don't think she doesn't look like she's infectious with swine flu.
She's enjoying the beautiful weather today. And we have one more question from 7th Avenue. We found one other person. Let's see what our final question from the Avenue is.
Okay, to my understanding, the swine flu is out here in New York. I'm just wondering, can it get any worse?
I don't think anyone knows 100%, but just from the way it's behaving so far and the fact that it's been in Mexico for quite a long time, that it's probably going to follow the course of the regular flu. We're going to learn things about our preparedness for if something had been more severe than this one. I think we're learning about what our stockpiles are for medications, for hospital equipment, how we deal with personnel issues. You know, in a regular flu pandemic, who's going to go for the firemen? Who's going to report to work with the policemen? Because they're going to be sick as well. So there are a number of questions we have to answer to see if we're ready for the flu. For this one, well, again, nothing is 100%. It seems like it's going to follow the course of the regular flu, and most people will get it and get better. So I want to thank you all out there on the street, because I think those questions mirror the questions that most people have in the audience. And let's take a short break now, and when we come back, we'll wrap up swine flu, and let's get to some regular illnesses, okay? Take care. Welcome back to Ask the Doctor. With me I have Dr. Margarita Khotsyna, Dr. Montgomery Douglas, and Dr. James Rucinski. And never to not mention Monsignor Bennett, who's sitting there through 8 seasons. The swine flu did not stop Monsignor Bennett, this epidemic. He's here, he's out in full force, not even a face mask on. He's here, he's showing his confidence in what we said, that the flu will be okay. Thanks for coming, Monsignor. And now we're going to get to our emails, the ones you've been sending in for the last few months, and we're going to get to them all. So we're going to try and get through as many of these as we can. I'm going to go to Dr. Rucinski first. It's from Victor of Williamsburg. A lot of good restaurants, but we're not going to talk about Williamsburg now. What is laparoscopic surgery?
Laparoscopic surgery is surgery that's done on the abdomen that involves the use of small incisions that allow the surgeon to use a fiber optic camera in order to visualize the internal structures on a video screen. And then using special instruments, the intra-abdominal operation can be completed with only using small incisions without having to make one of the larger incisions that surgeons did in the past.
Very good. Thank you. I hope that answered your question. Now we're going to go to a question from Peter from Greenpoint, an interesting neighborhood in the city, large Polish population. Question I'm going to ask Dr. Douglas and then Dr. Rucinski. I'm a man with large breasts. Is this dangerous? So what are some of the causes for large breasts in men?
Yes, obesity is a very common cause. Sometimes there can be a hormone problem. The question is it asymmetrical or symmetrical? If it's symmetrical, then I'm less worried about it. Mm-hmm. I mean, nobody's completely symmetrical, but if there's a big difference between left and right, or vice versa, mm-hmm. then I would you would want it evaluated. But the most common cause is actually obesity.
And can we do, you know, I see ads in the paper, you open up the New York Post, you see a man with large breasts, and then 2 days later they show the result of plastic surgery. Is this something that people should seek out, do you think?
Well, not necessarily. I think it's important to have a doctor's evaluation for large breasts. Mm-hmm. The obesity is a common cause, or hormonal problems. They can also be associated with medications. Very often enlargement of the breast comes about as a side effect from medication. Evaluation, now breast cancer is very rare in men, but it can be possible, and that's really what Dr. Douglas was saying mm-hmm. when he was saying he was worried if it affected one breast more prominently than the other. But evaluation for it is fairly simple with the doctor's examination and mammography, just as is used in a woman, and sonography, just as is used in the evaluation of a woman's breasts.
Interesting. Thank you. Here's an interesting question from Gwen from Sunset Park, not far from us. I'll open it up to the panel. My doctor mm-hmm. tells me I have 3 breasts. I always known there was a lump under my arm, but did not know that I had another breast. Should I have a mammogram of that breast? This is from Gwen.
Great question. Having accessory breast tissue is a very common phenomenon. In the development, in embryologic development before one is born, there's a whole line of nipples and breasts that's in the embryo, and they go away by the time of birth. But in my practice particularly, I very often see women with accessory nipples in the line of the breast or with accessory breast tissue in the axilla. And generally speaking, it can be evaluated at the time of regular breast imaging with mammography and sonography. But treatment is not necessary unless some particular symptom is arising in association with it.
I think, I hope that helps you, Gwen. Thank you for the question. Here's an interesting one from Anthony from Queens Village. I'm 70 years old. Is there any special blood test that I should have as part of my routine checkup every year? I want to stay healthy. Mm-hmm. Dr. Khotsyna, you deal with the people in that category.
Right. So in addition to the regular blood tests, I think what will benefit would be the checking the lipid profile, the cholesterol, the good cholesterol, bad cholesterol, and triglycerides. The PSA test, which is also maybe PSA may be helpful, but it also depends. I think lately there is a lot of controversies regarding the testing the prostate with the PSA test versus non-testing. But it all should be individualized, and just you should discuss it with your doctor.
That is a controversy, PSAs. Are you still sending your patients for PSAs, Monty?
Actually, I discuss the pros and cons of PSA and tell them about the uncertain benefits and of it, and I'll help the patient decide. At that age, actually, PSA is less useful than actually maybe in the 50s and 60s. So the other test I would add would maybe a urine test, a urinalysis. Maybe at that age, that might be something you want to consider also.
Interesting. Thank you very much. Here's one from Flushing, from John of Flushing. Beautiful city field out there. I don't know if anyone's been there. I heard it just like Ebbets Field. This John's saying, I'm experiencing frequent episodes of vertigo. My doctor tells me it's most likely benign positional vertigo. He wants to know, what does this mean, this BPV? So benign positional vertigo.
So generally, we have in the inner ear, there is a certain, it's called the canals. And there is a tiny stones can be positioned in certain areas on these canals. And when the vertigo usually occurs when somebody changes the position in the head. And of course, it causes the changing in position of those tiny stones in that inner ear. And this is what the benign positional vertigo is. The way to deal with it and treat that condition, there are certain maneuvers that are done by the neurologist or specially trained physical therapist by using special maneuvers can reposition those tiny little stones, and the symptoms disappear.
That's very interesting.
Yeah.
It's like little rocks in your head, and you move it around.
Yeah, you can say that.
So, John, I hope we didn't disturb you. You don't have rocks in your head, but I think it's good news. Do you have, Jim?
Yeah, I'd like to volunteer. I had this, and the neurologist put me through this maneuver where he sort of stood me on my head and rolled me around, and it worked. It was a miraculous cure.
Oh, that's great. Because I know my brother did that to me when I was younger, but it had nothing to do with that. Okay. Oh, here's one from Staten Island, across the bridge there from Staten Island land. Are there special vitamins that a senior citizen should be taking? I mean, I always wondered if that Centrum Gray, which I wouldn't be taking at this age yet, but does that make any sense to take special vitamins for the seniors versus the young?
I think lately there are a lot of questions around about the vitamins and supplements, and when I see patients, particularly elderly patients, most of them take multiple vitamins or supplements. There have been multiple studies testing different supplements, and so far there are only 2 vitamins that have been found to be beneficial. One is a calcium in treating and prophylaxis of osteoporosis, and the second one is a vitamin D. So far there is only 2 vitamins that I can recommend as being scientifically proven to be helpful.
Good, very good. Let's see. Oh, from Anne Marie, not far from Park Slope. Is there any harm in using Benadryl as a sleeping aid every night? I can't sleep without it.
Yes, I know many people do that, and but I don't think that's a good idea because that can interrupt your sleep architecture, meaning that if you're having trouble sleeping, the first thing to do is work on the sleeping habits, which the fancy name for it is sleep hygiene. If you find yourself using a pill every night, then you're going to end up depending on it, and then the sleep habits, are not helped. So I would not recommend it, and also you can end up being sleepy next day from using Benadryl.
I think it's point also that Tylenol PM, all these medicines combined with the painkiller, that most of these sleep aids have Benadryl in them. So you may not realize you're even getting Benadryl. You think you're taking Tylenol PM, but you're getting Tylenol and Benadryl.
I would like to add something, and I think this is very dangerous for people who are elderly, because Benadryl can cause severe confusion and multiple other side effects, such as, for instance, which is very dangerous, potentially life-threatening, such as urinary retention. And so the urinary bladder can rupture and people may die. But in generally, Benadryl is absolutely contraindicated in people who are elderly. And that's why Dr. Garner, brought a very good example of somebody of a Tylenol or any other over-the-counter preparations that say PM, because most of them contain Benadryl.
Thank you. Oh, here's one from Andrew from Brooklyn Heights. Beautiful view of the city there. That's a beautiful place. I'm a 60-year-old man. He wakes up to go to the bathroom 6 times every night. My wife tells me I have BPH. We get a lot of abbreviations here tonight. What is BPH, and what can I do about it?
Okay, BPH is benign prostatic hyperplasia, which is a fancy word for enlarged prostate. And as you know, the prostate is right behind the bladder, and sometimes when it gets enlarged, that can actually press on the tube that's coming from the bladder down into the penis and to urinate. So that can actually prevent the bladder from emptying completely, resulting in you having to just keep getting up to pee each time. So that's one of the things you want to see your doctor about, your primary care physician, and see whether it's something that can be done. There is effective treatment available. Yes.
Dr. Rucinski, surgery-wise, is there anything that can, stop this marathon every night, this 6 times a night?
Yeah. Endoscopic surgery done by a urologist can solve this problem and is useful in most cases when medications are not entirely effective.
I wonder if you could put the bathroom way down the hall, and then it's like exercise at least you're getting. You can count that towards your daily exercise. Okay. Oh, here's an interesting one from Lucy from Long Island City. Is there any cure for keloids, and what are they? What causes them? Keloids.
The surgeon?
Well, keloids are, the term keloids refers to scar tissue that extends beyond the edges of the healing site. Many people have prominent scars, and they are sometimes considered to be keloids, but they're really not. Keloids are a much worse phenomenon that extends beyond the limits of the original injury, almost like a mushroom. An important thing to remember for people who are worried when they have a cut or have had an operation and they're worried about how it's healing is that it takes a while for the scar to develop. The initial period of healing is in about the first 6 weeks, but the further maturation of the scar takes about 8 to 12 months before it finally finishes healing and shrinks down and fades and has a more acceptable cosmetic appearance.
Seems to be more prominent in certain groups, right? In African Americans and...
Yeah, keloids are more common in people of color, but in general, it's a fairly rare phenomenon.
Rare, that's good. That's good, but it can be quite upsetting. I know I've seen people, particularly if it's in a cosmetically unacceptable spot, it's disappointing. I hear Claire from Red Hook, not far from us. I hope they develop that Gowanus Canal one day. That could be quite like a San Antonio type situation. It's beautiful.
They're working on it now.
They are working on it, right? Is there a cure for high blood pressure? Claire from Red Hook wants to know. Is there a cure for high blood pressure?
Yeah, unfortunately, Claire, there is no cure for high blood pressure. Some people get lucky, and 1 in 20, their doctor is able to get them off medication by them following lifestyle improvements, and some are able to get off. But for the most part, it's incurable, but we do have ways to control it, namely through less salt, losing weight if the person is overweight, exercise, eating a higher potassium diet, and medication, and stress management, and adequate sleep. So yes, it is unfortunate when you have it, but it can be managed.
Yes?
There are kinds of high blood pressure that can be cured. An example would be, for instance, high blood pressure can sometimes be the result of a tumor of the adrenal gland. And surgery to remove that diseased gland would cure high blood pressure in that particular person. But unusual or rare causes of high blood pressure like that are something that everyone's doctor knows about and checks for at the time of their evaluation.
Thank you. Let's see. Whoa, here we have a long one now. Excuse me. This is, I tested positive for a stress test. My blood count was 10.9. One doctor suggested an angiogram, another a nuclear stress test. I just read your article about coronary artery CAT scans. Can that be performed to determine if I have further issues, since it is non-invasive? So the question has to do with how to detect heart disease in a non-invasive way. And she's referring to a test that I wrote about in a tablet column called the coronary CAT scan. Takes 17 seconds, shows calcification in the vessels, and predicts your risk of having a heart attack later on in life. No test is 100%, but I think it's a good way to, to get an idea of what your risk factor is. So could ask your doctor for the coronary artery CAT scan. I'll turn it over. Anybody else have any
Well, the thing I would add would be, to answer your question, is that if you already have an abnormal stress test, then that initial test is abnormal, so you need to go to the higher level test actually at this point. So that would not be the test you would go to next, actually. You really do need either those tests that you mentioned. You need the angiogram, or you need the nuclear stress test as the next step from that regular stress test.
Spoken like a non-radiologist. Thank you. So let's go to the next question now. What is the next step after being diagnosed with vascular disease in my arms? This is from Inez. I won't tell the last name, but Inez. Vascular disease in the arms.
Yeah, when I first saw that question, I wondered about it. I think I need to know more about the nature of the disease, whether it affects the arteries or the veins, and what the symptoms are that are related to it. So I'm sorry, I don't have an answer for that one right off.
Here's from Laura. My daughter has really bad breath, and she's always suffered from constipation. She's only 3 years old. So is there a connection between bad breath and constipation?
I'm not sure, actually. I think, first of all, that the attention should be paid to the mouth health. You know, you have to show your daughter to the dentist, and this is where you begin. And if this turns out to be normal, I think then you speak to your pediatrician, and then, you know, you can take it from there.
Right.
But the first step would be to show your daughter to the dentist.
Right. The most common cause of bad breath is dental problems. 3 years old, there can be constipation. Oftentimes, there's a need to modify the diet to include more roughage. Not everybody has a normal flowing bowel, and sometimes if your bowel is on the slow side, then you need more roughage to actually help it through. So if your daughter has constipation at age 3, the first thing would be drinking more fluids and eating more roughage. And if that doesn't work, then see your doctor, either your family physician or your pediatrician, to look into that. There might be a gastroenterological problem, meaning a problem with the stomach, for example, that could be causing that. Bad breath could also be caused by a stomach problem as well. That would be much less common than the dental problem.
So Laura, get her in and let's get this straightened out. What does airway diffusely patent mean? I recently had a CAT scan of the neck because of cysts on the parotid glands. One sentence under impression was airway is diffusely patent. Teresa. Teresa, that means basically that you've got no problem in the bronchial tubes that supply the lungs, no tumors, no problems like that, no cysts, no. So it's a good thing to have diffusely patent, means it's wide open. So we'll move on because we read your column in the tablet that antihistamines can cause confusion and forgetfulness. My concern is this. For my seasonal allergies during spring and fall right now, I forget things here and then when I should sense the side effects of this. My doctor advised me to have allergens introduced in my body gradually for 5 years. So I want to know, is there any benefit to these injections that he's talking about? I guess the allergy shots that some people get, as opposed to taking too much Benadryl.
Yes, well, you know, in a situation where you have moderate to severe allergy problems, especially if it's year-round, then some people consider what they call immunotherapy, which is taking allergy shots. The thing about it is that, you know, after you've taken a good 2 years, sometimes you don't ever have to worry about allergies again. The problem with it, though, is taking shots every week for 2 years. You know, that's a long haul. So you wouldn't do it unless you have moderate to severe allergy problems. You know, if you have mild to moderate, the thing to do is just take the allergy medications. And now that they have non-sedating, meaning allergy medications that don't make you sleepy, then that makes it much more convenient that you don't have to take Benadryl per se, which does make people drowsy. You can take one of the other ones like Claritin.
Good. Very good. We'll move on. Thanks for reading the tablet. Hello, Dr. Garner. I was visiting Brooklyn on February 24, 2009, and happened to see a show. It was very good, by the way. Good judgment. I was the last caller. We didn't have enough time. My problem is I'm in extreme pain in both my upper arms and neck. I have 2 torn rotator cuffs. I have no strength. It hurts when I hold the phone for a while or try and lift my jacket off the hook. I have a degenerated disc in my neck and narrowing of my spinal cord. I'm looking for relief. Can you please help me? And he put 6 exclamation points. Thank you for your show and for your time. That's a tough one. I mean, there are multiple. Jim,
well, you know what a question like this or a problem like this, to me, is calling out for a multidisciplinary approach. And I think that in evaluating something like this, a good place to start would be the Brooklyn Spine and Arthritis Center, as like we have at New York Methodist Hospital, that takes an integrated approach involving orthopedic surgery, neurology and neurosurgery, physical medicine and rehabilitation, diagnostic imaging, all in a concerted approach to evaluate and treat a complex problem like this.
Thanks. And this is really, Robert, no way to live. I mean, we can help you. Hopefully you'll be visiting Brooklyn again, and we're going to kind of wrap it up here because we got so tied down with the swine flu and these questions. Again, bottom line on the swine flu, looks like the regular flu, nothing special to worry about. Wash the hands, stay away, stay home if you're sick. Any other tips on the swine flu?
No, we covered it all.
Don't mix it up with the cold. If it's the cold, it's the cold. If it's the flu, then that's a cold on top of, a cold plus body aches, muscle aches, not feeling well, upset stomach, and moderate to high fever.
Jim, sure.
And don't worry about eating the other white meat. Most good restaurants in Brooklyn have it on the menu.
Right, okay, yeah, there's no... And I think that's it for this edition. It's been a special edition. It's a swine flu edition that we haven't had such an episode as such, but I don't think we've been through time such as this since the show's been on the air. Now, 8 years that it's been on the air. So I want to thank my guests who've come out in the night for this episode, Dr. Margarita Khotsyna, Dr. Monty Douglas, Dr. Jim Rucinski. We hope that we've been able to help you. It's good to remember that you should be proactive about your own health. Speak to your doctors about your concerns. Go for second or third opinions. In the meantime, continue to watch this show every Tuesday night, or visit the website www.netny.net/askthedoctor. You can send me questions through the website. I'll bring them in for discussions on future shows, and we'll try to answer as many of these questions as possible. And I'd like to not forget to thank Brother Leonard Conway, Mary Pappas, Carol, and Christopher for taking the time to talk with us. It is my pleasure to be back for this 8th season, so I'll see you again next week at 8 p.m. Goodbye, stay healthy, and I'll see you in the tablet.